Hello, beautiful people. CONCISE Nursing comes your way once again. Please, if you're new to the channel, click on the subscribe button and then also click on the bell so that anytime you upload a video, you will be notified, and also share it to your friends so that we can learn together as nurses. Today we are looking at something under Obstetrics and Gynaecology. What we shorten is as Obs and Gynae. Okay. As nurses, we need to know something about midwifery as well, so we are not left out. So CONCISE Nursing is making it so simple for us. Today we're looking at some terminologies, some terms under midwifery or some terms under Obs and Gynae. All right, so without wasting much time, let's begin. All right, the first time you will look at is midwifery. It's midwifery. This is the care dealing with childbirth, including pregnancy, labor, and puerperium. Okay, so midwifery simply means the care that is given to a pregnant woman throughout the pregnancy period, to the labor, and also throughout the puerperium stage. Pretty soon you know what the puerperium stage is. That is the afterbirth. Okay, the next word you want to look at is obstetrics. And we say obstetrics, what does it mean? Now, obstetrics, the branch of medicine dealing with pregnancy, labor, and puerperium. Okay, so this is a branch of medicine, okay, that is dealing with pregnancy, labor, and also the same puerperium stage. That is some weeks of 8 weeks, specifically 8 weeks after delivery. Okay, so that is a branch of medicine that is dealing with that. Now let's look at what you call gynecology. All right, gynecology. It's also a branch of medicine dealing with diseases peculiar to women. So gynecology has to do with a branch of medicine that is dealing with diseases that is only peculiar to women alone. Okay, so when you say diseases that are peculiar to women alone, you know it's around their reproductive system or the reproductive organ. So that is it about midwifery, obstetrics, gynecology. All right, the next time we want to look at is who is a midwife. All right, so a midwife is a person who has been professionally trained to take care of a pregnant woman in labor and the nursing mother and her baby. Okay, so the midwife is a person that has been trained, okay, to take care of the pregnant woman in labor, and also the pregnant woman that has given birth, newborn baby, and also the mother. So that is a midwife for you. All right, let's look at domiciliary. Domiciliary, it is related to domiciliary nursing. Okay, so domiciliary nursing, it means caring for the pregnant woman in their own home by the midwife. So domiciliary has to do with your dwelling place or your own house. So domiciliary midwifery, midwifery has to do with taking care of the pregnant woman, her labor, and also her puerperium stage in her own house. That is the domiciliary midwifery. All right, now let's look at what you call the puerperium. All right, so puerperium, this is the period of 6 to 8 weeks following childbirth, during which the uterus and other reproductive organs return to their pre-gravid state. Okay, so the period after birth to the 6th week or the 8th week, that is 2 months after birth. So the period between that, okay, whereby the reproductive organs of the woman return back to the pre-gravid state. So the pre-gravid state, it has to do with the states that the reproductive organs were in before pregnancy occurred. Okay, so during pregnancy, a lot of changes happen in the reproductive system. So the puerperium stage is when these reproductive organs, the changes that occurred, will also go back to the normal state. Okay, I hope it's very clear. Okay, All right, the next term we want to look at is what you call maternity. Before I heard maternity before, maternity what another way, another thing. So maternity simply means childbearing or the process of being a mother or motherhood. Okay, so maternity is a hospital facility designed for the care of women before and during childbirth and for the care of their newborn babies and their mothers. So it's a special facility for pregnant women or women who are about to give birth, those who have given birth, their children or the newborn babies, and so also the mother. So that is that about maternity. Now let's look at what we call sizes. We call it sizes or pregnancy. So it's self-explanatory. So sizes in midwifery simply means pregnancy. This is the state of having fertilized developing ovum in uterus or elsewhere. So when an ovum in the uterus is fertilized, you say you are pregnant. As simple as that. And the term is, in midwifery, we call it sizes. So pregnancy can occur in the uterus or elsewhere. It means you can be pregnant, but the fetus or the embryo will not be lying in the uterus, but then elsewhere in the body. Later we will dive into that more. Now let's look at what we call gravida. Gravida. Gravida is being in a state of pregnancy. So when you are pregnant, it's gravida, okay? State of pregnancy, that is gravida. We have what we call primary gravida. These are terms you'll be using later. So just know the meaning so that when you start using it, you don't get confused. So primary gravida means being pregnant for the first time. So when you're pregnant for the first time, it's primary. That's primary gravida. You're pregnant for the first time. Let's look at multi. So multi-gravida. Multi-gravida, one who has been pregnant for more than once. So if you get pregnant first one, you get pregnant second one. From the second one going, or it's multi-gravida. All right, now let's look at what we call para. Okay, para means having a child. Okay, so gravida is pregnancy and para is having a child, or when you have given birth, you call it para. Now, we have what we call primary para. Let me clear the top. Okay, so primary para simply means having had your first child. It means you have given birth for the first time. That is primary para. Now, multi-para. Multi-para simply means one who has had or delivered more than one. So if you have more than one children, or you have given birth more than one biologically, we call it multi-para, or you have given birth more than one. Okay, so after multi-para, the next thing we want to look at is grand multi-para. Grand multi-para is one who has had more than 5 children, 6 or more. Okay, so after you giving birth more than 5 going, you are no more multi-para, but grand multi-para means you have graduated to the next level. Okay, now let's look at nullipara. Nullipara, a woman who has given birth, a woman who has never given birth to a child or never delivered. So that is nullipara. Means you've never given birth to a child before. All right, let's look at what we call gestation. Gestation happens to also be a very familiar word. So it means the period of pregnancy. Normal duration of pregnancy lasts for 280 days. So it lasts for 280 days or 40 weeks. Okay, or 9 months. Okay, so this is the duration for gestation for human beings: 280 days, 40 weeks, or 9 calendar months. Okay, now let's look at what we call pseudo sizes. Pseudo. We all know what pseudo is. we have just read about sizes. So sizes is pregnancy. So pseudo means false. So false pregnancy. Now, this is a psychological disorder in which a woman has a false but fixed belief that she is pregnant. So it's a psychological disorder whereby the woman thinks she's pregnant, no matter how you try to explain to her that you are not pregnant, madam, you are not pregnant, please go home. She said, no, I am pregnant. So that is pseudocyesis. Now let's go to fertilization. Fertilization is a term used to describe the fusion of the sperm and the ovum. So when sperm, male sex cell and then the female sex cell comes together, we call it fertilization, as simple as that. Now let's look at ovum. The female reproductive cell. It is also used to describe the fertilized ovum during the first 3 weeks of pregnancy, which we call the zygote. So ovum is the woman, the female sex cell, okay? The female sex cell, plural, we call it the ova. Okay, so the woman, what we call the egg, is what we call the ovum in Obs and Gynae or under midwifery. Now let's look at what we call embryo. Embryo, the fertilized ovum for 3 to 8 weeks of gestation. Okay, so if you are pregnant for between 3 to 8 weeks, we call what is inside you the embryo. It is no more fetus. It is not fetus yet, the embryo. Now let's look at fetus. Fetus is the development of an ovum from the 9th to 40th weeks of gestation to delivery. So after the 8 weeks, this is 3 to 8 weeks. So after 8 weeks, from 9 weeks onward, to 40 weeks is fetus. Alright, let's look at when you say something viable. When you say fetus is viable. Now it is used to describe a fetus that is capable of separate existence outside the mother. Okay, so viable seed means a seed that is capable of existing or growing up. So viable in terms of fetus too is the fetus that is capable of surviving outside the mother. So when they give birth to you and then you can survive, you say you're viable. All right, now let's look at what we call term. Term. This is terms. It's an English word. When you say term under midwifery or under Obs and Gynae, it means different thing. Now, the gestational period where delivery is considered normal. So the gestational period whereby a pregnant woman can deliver, and it is not very normal. That is when you say it is term. All right. Now, 37 completed weeks or 38 to 40 weeks of gestation is said to be normal end of pregnancy. So from 37 weeks going, 37 weeks to 40 is termed as normal, and then that is what you say we call it term. So the fetus is a term. All right. Now let's go to when we say preterm. Preterm. A baby born before 37 completed weeks or less than 38 weeks and may or may not weigh up to 2.5 kg. Okay. So if you give birth less than 37 weeks, it is termed as preterm. And if your baby is also weighing less than 2.5 kilograms or 2,500 grams, it is also termed as preterm. So your baby should weigh more than this, more than 2.5 kg at term, and also you should deliver after 37 weeks to 40 weeks. Then it will not be termed as preterm. Anything below that is preterm. Now let's look at what when you say trimester. Trimester. It is 1/3 of the normal gestational period. First trimester is the first 12 weeks. Second trimester is the 13th to 24th week, and the third trimester is from 25th week until delivery. So the period of gestation is divided into 3. We have the first trimester, we have the second trimester, and then we have the third trimester. Okay, so the first trimester is from pregnancy, from the first day of pregnancy to the 12th week. Okay, second trimester is from 13th to 24th week, and then from 25th week to 40 or till you deliver is termed as the third trimester. Now let's look at how you say partum. Partum simply means delivery. So when you're going to give birth or delivery, process of delivery is called partum. So we have what we call the antepartum or antenatal. Let me write antenatal first. Antenatal or antepartum. That is anything that happens before delivery. That is antenatal or antepartum. So before delivery, from pregnancy to delivery, all the process you go through is antenatal or antepartum. Then let's look at postnatal or the postpartum. Post means later or after. So after birth, that is postpartum or postnatal, anything after birth, after you have given birth, all the things that you go through. So antenatal, that's why we have something called antenatal clinic. So the clinic you go before delivery, you have the postnatal clinic, that's the clinic after delivery. All right, very self-explanatory. All right. Now, let's look at abortion. When you take abortion, what does it mean? This is the expulsion of the product of conception from the uterus before 28 weeks of gestation. So anything less than 28 weeks of gestation, being it spontaneous or not spontaneous, is called abortion. Okay, so all the products of conception will just fall off like that from the uterus, through the cervix, through the vagina, and everything is gone. So it's called abortion. Now let's look at miscarriage. Later we will take time and go through this into details. You will realize that miscarriage falls under abortion. So that is spontaneous abortion. Okay, so miscarriage is not something that you will force it to come. Okay, you will just be there due to one or two reasons. The pregnancy will just fall off, or to just drop off like that, probably due to incompetent service or something. Okay, so that is miscarriage. That is spontaneous abortion. Now let's go to what we call operculum. Operculum. This is the mucus plug in the cervical canal during pregnancy. So the cervical canal is the cervix. So uterus is up like this. There's a small plug beneath here before the vagina comes down here. So this place during pregnancy, it forms like a ring to seal the uterus so that products of conception does not fall off through the vagina. Okay, so the operculum is here. It is mucus, means it is kind of slimy, so it seals the uterus from the vagina. That is why during pregnancy, when you have sex, the sperm doesn't even get chance to go to the baby. It will just come out again because it doesn't get chance into the uterus. It will just be here. So that is operculum. Now let's talk about show. Now realize Obs and Gynae has a lot of terms. Show. This is the dislodged operculum at the onset of labor. So the operculum will just dislodge one day. You will just wake up and the operculum will just dislodge. Then products of conception will begin to come out. That is show. So when this mucous membrane or the operculum begins to fall off, it is slimy, and because it is mucous membrane, it has this blood tissues in it as well. So there will be stains of blood in it, and then it will just come out. So the woman, when you see something like that, you realize that now your time is almost up to deliver. So we call it as the show. Okay. Now let's look at what we call the placenta. Now the placenta is the afterbirth or the fetal organ. That's what you call it, the fetal organ. So the moment you get pregnant, at the early stages, placenta is also formed. So it is in the uterus with the baby. As the baby is growing, placenta is also growing. And it has various nutrients that it supplies to the fetus through what we call the umbilical cord. Okay, that's what we call the fetal organ. So all the nutrients that the fetus will consume or will live on is coming through the placenta. Okay, and also waste products from the mother will pass through the same umbilical cord to the placenta and then to the mother and then outside of the body. Okay, so that is the placenta for you. So when you give birth, placenta is also coming out. So you give birth and then the afterbirth. So that is the placenta. Now let's look at what we call membrane. So membrane, these are layers of tissue called amniotic sac that holds the fluid that surrounds a baby in the womb. It ruptures prior to delivery. All right, so these are like membrane are layers of tissues. Okay, they surround the baby. Forms under the fetus is lying inside here, so it is surrounding the membranes are surrounding it like this, and then we have fluid inside here called the amniotic fluid. That is where the baby is able to swim and do his 1 or 2 navigations. So this is what we call the membrane. The outer sac is what we call the membrane. Okay. All right, and then this will rupture prior to delivery. So it will rupture means it will break, and then fluid in it will fall off, lubricating the vagina so the baby can also pass through and come with the placenta. Okay, so that is that about the membranes. It can rupture 24 hours prior to delivery. So membranes will rupture, and then fluid comes out, so before the baby follows. In a state whereby you are dilating, but then the membrane is still intact, you have to forcefully break it or rupture it before the baby can come out. All right, so that is it about membranes. Now let's look at finis. Finis is simply the umbilical cord. So I spoke about the placenta. The connection between placenta and the fetus is what you call the finis. So it's a cord. Okay, baby is here, placenta is here, and then that's the finis or the umbilical cord. Now let's look at Lycor amni. All right, so the Lycor amni, or the amniotic fluid, the fluid in which the fetus floats in the uterus. So the fluid inside the membranes we have here, we call it the amniotic fluid. That is what we call the amniotic. So the amniotic fluid is what we call the Lycor amni, simply put. All right. Now let's look at quickening. Quickening. It is the first fetal movement made in the mother, which usually occurs between 16th to 20th week of gestation. So at a point in time during pregnancy, you can feel that your baby is hitting your stomach. You see, it's like the baby is playing football in your stomach. We call it quickening. And the first time it happens is from the 16th week, between 16th week and the 20th week. 16th week to 20th week. After this week, if you have not heard about the quickening or your baby is not beating in your in the uterus, it means it is questionable. We have to look at it. So probably baby is dead or something. So that is quickening for you. You should hear that the baby is kicking. All right, let's look at lightening. Lightening. It is the descending of the fundus and the relief of pressure experienced by the mother. So the relief of fundus, you know, when you get pregnant, the top here, the uterus will be pushed up to a certain level. So the top part of the uterus during pregnancy is what we call the fundus. So the descending of the fundus, releasing pressure from the mother, is what we call the lightening. It means you're about to give birth or labor has set in. Okay, so lightening occurs when labor has set in as a result of engagement of the fetal head. So the fetal head will engage in the pelvis. That is what is going to relieve the fundus, and it also relieves pressure from the mother. So that is lightening. Now let's look at what we call engagement. Engagement is not a marriage engagement. This is engagement in Obs and Gynae. Now, when the widest presenting transverse diameter of the fetal scar or breach has passed through the pelvic brim, very soon you know what the pelvic brim is. But then when the presenting part, being it cephalic, that is the fetus is coming with a head, big head, is coming. Then if this head passes through the pelvis, or the presenting part is able to engage itself into the pelvis, means it's coming down. That is engagement. It has engaged itself. Some babies also choose to come breach. That's with the abortus. So when this part is able to pass through or engage to fix itself into the pelvis like that, means it's coming down. That is engagement. Okay. So when the presenting part engages itself in the pelvic brim, that is engagement. Now let's look at menarche. Menarche, simple word. That is the initial or the onset of menstruation. In every woman, menstruation occurs. So the first period you have, or the onset of it, is what we call menarche. Okay, now let's look at amenorrhea. Amenorrhea simply means absence of menstruation. So there are some women whose menses are not coming, or the menstruation blood flow is not flowing. That is amenorrhea. You have what you call dysmenorrhea. Dysmenorrhea has to do with painful menses. So pain, this means pain. A means absence. So amenorrhea and dysmenorrhea. Dysmenorrhea is painful menstruation, and this one is no menstruation. Now let's look at Miltelschinez. See, it's a big term. Miltelschinez, big term with a small meaning. So this is the pain you experience during ovulation. This is different from the pain you experience during menstruation. This is Miltelschinez is pain during ovulation. So when you're ovulating, you know, when you're ovulating, you have that kind of some down feelings and then some little up pains in the abdomen. That's what we call the Miltelschinez. But then dysmenorrhea is when the blood is actually flowing out and you are in pain. That is dysmenorrhea. So that is the difference between Miltelschinez and dysmenorrhea. Now let's look at menopause. Menopause has to do with the cessation of menstruation. So at a certain level in your age, as menses commenced, that is the menarche, menses has to also come to an end or has to cease. And that is what you call menopause. So that's the last menstruation or the cessation of menstruation. That's what you call menopause. We also call it the climacteric. Okay. So menopause or climacteric means you are climaxing the whole thing. Okay. That is that about amenorrhea, dysmenorrhea, Miltelschinez, menopause, and also climacteric. Alright, so the next term we want to look at is after pain. After pain, the lower abdominal and waist pain as a result of contraction of the uterus occurring in the early days of puerperium. So puerperium has to do with after delivery to like 8 weeks. So the pain that you feel in your lower abdomen, then in your pelvis, due to the contractions that has occurred in that place, is what you call the after pain. Okay, lying in or the lying in period is the period after delivery during which the mother and the baby are strictly under the care of the midwife. Okay, so lying in, if it's domiciliary midwifery, it will be in your house. You'll give birth and then the midwife will come and take care of you in your own house. But if it's in the hospital, that's what you call the lying in period. So the period whereby you and the mother and the newborn neonates are in the care of the midwife at the hospital. Now in Ghana, this takes 7 days. Okay, that's 1 week. And then in England, it takes 10 days. But in Ghana now, because of space matter, you give birth today, probably tomorrow you are discharged to go home, and another thing. So that's the lying in for you. Lying in period. Okay, now let's look at neonates. What is a neonate? Neonate is the newborn baby for the first 28 days. For the first 28 days, that is 1 month. 1 month, and the newborn baby is born. New child is born for the first 28 days or the first 1 month. It is called a neonate. Okay, let's look at what we call congenital. Congenital, pertaining to something present at birth, either due to hereditary or intrauterine origin. So anything that you are born with, you have congenital defects. So anything that you are born with, any defect that you are born with. Some people can be born with only one eye. Some can be born with only one arm. Some can be born conjoined twins. So congenital, anything that you are born with, you didn't attain it on this earth, you were born with it. Congenital. Now let's look at labor. Labor, the process by which the process of pregnancy is expelled from the body or the uterus after 28 weeks of pregnancy. You remember abortion. Abortion is before 28 weeks. Now after 28 weeks going, we call it labor. Process of conception from 28 weeks all to 40 weeks is labor. But 28 weeks to 37 weeks will be a preterm baby. You understand? Okay. So after 37 going to 40, that is when it becomes a normal labor. Okay, so that's labor for you. Products of conception are being delivered after 28 weeks. Now let's look at dystocia. Dystocia. It is a difficult labor or painful labor. So when you are in labor and then you are feeling so much of pain, you are in serious distress, we call it dystocia. Now look at Eutocia. Eutocia is the normal labor. You go and lie down, the baby will come. That is Eutocia. You did not suffer. Dystocia really suffered before the baby came out. So labor, dystocia, Eutocia. Labor is product of conception is coming out. If you are in pain during that process, we call it dystocia. If you are not in pain, it comes out normal. That is Eutocia. Now let's look at episiotomy. Episiotomy happens to also be a very familiar word. Now episiotomy is the incision made between the perineum during delivery for the baby to increase the outlet. So during delivery, if the vaginal canal is too narrow or the orifice is too narrow and the baby cannot come out, right, this is the vagina and this is the anal region. So the part in between here is what you call the perineum. Perineum. Okay, so episiotomy is made or incision is made. You put scissors and you cut, so that the vaginal canal will increase in size so that baby can come out. That process is what you call episiotomy. After which the midwife will sit down and suture it together again. All right, let's look at something we call the BBA. It's an abbreviation that is born before arrival. So probably labor setting when you were in the house. Now, before you get to the hospital, you have given birth. That's born before arrival. So you were born on the way to the hospital. So BBA. Now the next one we want to look at is stillbirth. Stillbirth or stillborn. Okay. A child born after the 28 weeks of pregnancy that has not breathed or shown any sign of life after complete expulsion from the mother's body. So stillbirth is when the baby is fully born or fully delivered. Placenta is also out, and then the umbilical cord has been cut, but still baby is not breathing, baby is not crying, baby is not showing any signs of life. That is stillbirth. Okay, it's expected that after birth the baby should cry when the umbilical cord is cut. Once it's cut, air enters the lungs for the first time and baby is at shock, so baby will cry. Okay, but if baby is lying down, not showing any signs of life, it's not crying, it's not doing anything, it's not kicking, that is stillbirth. Now let's look at maceration. Maceration, the process of softening a solid by means of soaking, characterized by peeling off fetal skin. So fetus can die in the mother. Then after 24 hours, if fetus is brought out or cesarean section is done and fetus is brought out, the skin can peel off. And hold it will just peel off like that. That is what you term as maceration, the peeling off of the skin. Okay. Now let's look at involution. Involution, the return of the reproductive organs to their pre-gravid stage after childbirth or after delivery. That is involution. That's the process by which the reproductive organs return back into their normal states before pregnancy. And this happens in the puerperium stage. So involution happens in the puerperium stage. Okay. Okay, let's look at what we call lochia. Lochia, a collective name given to the discharge from the uterus after childbirth or abortion. So after you deliver, you don't go scot-free like that. There's a duration by which all the fluid in the uterus will drain. The fluid that is coming out is what we call the lochia, and it takes a number of days. It keeps changing colors as the day goes by. It is not supposed to be offensive. Okay, it should not have any offensive odor. That's what you call the lochia. It changes color day after day, and then a time will come, then it will cease by itself. So we call it lochia. Now, colostrum, a high protein fluid secreted by the breast from the 16 weeks of pregnancy and during the first 3 days of delivery. So lochia is colostrum is the first breast milk that comes out, and it's yellowish in color, very concentrated with nutrients. Please give it to the baby. That's what the baby needs most, to be sensible, to be very knowledgeable in life. Okay, so don't throw it away, the mothers. So colostrum is the first breast milk that is secreted, and it's formed in the breast from the 16 weeks of delivery. So the first 3 days, this is the breast milk that will be coming. So you give it to the baby, and it is highly concentrated with nutrients. Let's look at meconium. This is the baby's first tube present in the fetal intestine from the 16 weeks. It is dark green in consistency. Okay, so meconium is the first tube or the toilet that is found in the intestine of the baby. Okay, and it is greenish in color. So the first toilet of the baby is what you call the meconium. Now let's look at antepartum. Antepartum hemorrhage. Antepartum hemorrhage. Okay, it is a bleeding from the vaginal tract after the 28 weeks of pregnancy or before birth of the baby. So after 28 weeks of pregnancy, if you see any discharge or blood discharge from the vagina, it might not be coming from the uterus, but rather from the vagina. And that is what you call the antepartum hemorrhage. Okay. Now let's look at the postpartum hemorrhage. The postpartum hemorrhage, PPH for short. It is the bleeding from the vagina or the genital tract following the childbirth of a volume more than 500 ml or enough to cause the deterioration of the conditions of the mother. Okay, so after birth, there could be bleeding from the vaginal tract. And it should be more, like 500 ml, like a pure water sachet, full. That is 500 ml. And it should be enough to cause deterioration of the mother. Then we will term it as a postpartum hemorrhage. And it's an emergency, so the mother has to come to the hospital for doctors to look at it. Or if you're in the lying in already, then we will look at it over there for you. Now, PIH. Simply put, a pregnancy-induced hypertension, PIH for short. It is also called preeclampsia. So this is a hypertension that a mother or a pregnant woman has during pregnancy. Alright, a condition very peculiar in pregnancy which is characterized by hypertension, proteinuria and edema. So it is characterized by high blood pressure, that is hypertension, and proteinuria means there's protein in your urine, and also there's edema. That is the feet or the lower extremities become puffy. You press on it, it can be pitting or non-pitting. So that is about PIH. PIH, okay, pregnancy induced. We have to manage it as well, even though you are not hypertensive. But because of the pregnancy, that's why you're hypertensive, so you have to manage it still. All right, now let's look at eclampsia. Eclampsia. It is the worst stage of PIH, characterized by epileptic type of fit called eclamptic fit. Okay, so the high stage of PIH, that is the blood pressure, if it's not managed, it can rise to a certain level that it becomes an emergency. That if you don't take time, the woman can convulse or the woman can have convulsion. And if that fit sets, that's what you call a fit. If it sets in, you are likely to go into labor as soon as possible, and then you will lose your baby. Okay, so that is eclampsia. It is a gynecological emergency. Now let's look at what we call attitude. Attitude. The relationship of the fetal part to itself, fetal head and limbs to the trunks, flexion and extension is used. Okay, so the attitude has to do with the baby, how it is positioned in the mother's uterus. So the head is sunk in, the head is sunk into the trunk like that. The arms are folded and then the legs are also folded in that order. So the baby lies in the mother's room, something like this. Okay, and that is what we call the attitude. Simple. Okay. Okay. Now let's look at something we call denominator. It is not only in denominator. It is not only in mathematics where you have denominator. In Obs and Gynae too, we have denominator. An area on the presentation used to indicate the position of the fetus in relation to the mother's pelvis. Okay. So in vectors presentation, the denominator is the occiput. Okay. In breech presentation, the denominator is the sacrum, and in face presentation, mentum or chin is the denominator. So during engagement, the part that is engaged in the pelvic brim becomes the denominator. Okay. So that's what we say in the vectors presentation, the occiput. Alright. The tico and the barbershop pelvis. No. Okay. So that is what you call denominator. Okay. If the baby is coming breech, means the buttocks will come and fit into the pelvis. Okay, and that's the buttocks or the breech now becomes the denominator. Okay, if it is face presentation, baby is coming with the face, the chin is what was going to present. So the denominator is the chin or the mentum. Okay, so that is that about the denominator. Okay, now let's look at what you call portalic. You also call it the breech. That's breech presentation, means the child or the fetus or the newborn unit is coming with the buttocks. Okay, instead of coming with the head, it decides to come with the buttocks. We call it podalic or breech presentation. Let's look at LMP. LMP standing for last menstrual period. Now this last menstrual period is calculated from the first day of your menses. Okay, so the first day of your last menses is the LMP. That is your last menstrual period. Take note of it. You will use it in later days. Let's look at EDD. EDD is expected date of delivery. Expected date of delivery or expected date of confinement. So by the use of the LMP, we're able to calculate and know that this pregnant woman might give birth at this age, in this month, on this day. So use the LMP to calculate for EDD. Take note, we will come to it. Very, very important. All right, let's look at what you call A and C, antenatal clinic. Very simple. Antenatal clinic. So the clinic you go when you are pregnant. That's A and C. P and C, postnatal clinic. So the clinic you go after you have given birth. Postnatal clinic or postpartum clinic. All right, let's look at something we call the small for dates. So small for date, baby who weighs less than expected at the period of gestation. Okay, so probably you are around 37 weeks about to deliver, and your baby, the weight of your baby is very little. That is small for date. Small for date. So after delivery, the baby is weighing less than 2.5 kg or less than 2,500 grams. It means it is a small for date. Take note of that. Very simple. Okay. So here comes today's video. If it has been very useful to you, please subscribe and share for more videos as we journey through our CONCISE lesson. All right, so that is that. And then thank you very much. These are terms we just looked at. Pretty soon we'll be making use of these terms in our later days videos under Obstetrics and Gynaecology. Thank you very much and stay blessed. Bye bye.